I'm here with Rebecca Leung, who is a Master of Social Work student and also very interested in violence prevention. Rebecca, so glad that you're here. Tell us more about your interests, how you came into social work and your interest in violence prevention.
My background is in health IT, and I am interested in solving social issues around health that could be bridged with innovations in technology. And George Mason, being a program in the DMV area, provides the kind of clinical experience and the faculty research that I want to be involved in, to be studying here.
Fantastic. Can you tell us a bit about your studies and about your research?
My research is focused in any health topic, so it's substance use related, as well as IPV, which is intimate partner violence. And as Dr. Cleveland would say, hurt people is an intergenerational thing, and so I want to study that to stop violence from the get-go, so much more on the prevention side.
Very focused on prevention. That's what the beauty of the relationship between social work and public health is all about.
Yes, and the interdisciplinary part of where George Mason is, where there's policy, there is the engineering, there is social work is involved, makes this program very attractive.
What are your thoughts about violence prevention? We're shining a strong light on violence prevention, really wanting to raise awareness. Tell me your thoughts about it, how you've learned more about it, and how it's going to affect your work as a therapist.
Yeah, so violence prevention is extremely important, and I think it's really underestimated, actually, especially with the pandemic. The past 2 years, for the first year and a half, we were all isolated, and there's been so many families and individuals that haven't been able to tell their stories of family violence within the home. And I'm in this class, IPV, that all talks about violence prevention with families and individuals. This class really solidifies that the reports are extremely underreported. And so when I go into my field, I hope to be able to advocate for those survivors and for them to really be able to tell their stories. And this isn't just a nation issue, it's a countrywide issue, it's a world issue. And so family violence, IPV in general, is just really important to acknowledge and actually intervene.
I'm really struck by how you had some of your own theories based on your observations during the pandemic. You came into the classroom, you got to learn some more data, some more of the research to affirm what you had suspected, and now you're going to bring that into communities and into society to try to make a difference in preventing violence and make a difference for those who are survivors of trauma. I'm really glad that you're here, Anna, and thanks so much for this interview.
Thanks for your time.